This week, I asked Congress to schedule a final vote on reform that will give families and businesses more control over their health care by holding insurance companies more accountable. This comes after nearly a year of debate, as well as a 7-hour summit with Democrats and Republicans where we had a public and substantive discussion on health care. Since then, I've said that I'm willing to incorporate some ideas offered by Republicans, and we're eliminating special provisions that had no place in health care reform. Now, despite all the progress and improvements we've made, Republicans in Congress insist that the only acceptable course on health care is to start over. But you know what? The insurance companies aren't starting over. I just met with some of them on Thursday, and they couldn't give me a straight answer as to why they keep arbitrarily and massively raising premiums by as much as 60% in states like Illinois. If we don't act, they will continue to do this. They'll continue to drop people's coverage when they need it. They'll continue to refuse coverage based on pre-existing conditions. These practices will continue. And that's why we have to act now. That's why the United States Congress owes the American people an up or down vote on health insurance reform. The proposal we've put forward would end the worst practices of the insurance industry, lower costs for millions of Americans, and give uninsured individuals and small businesses the same kind of choice of private health insurance that members of Congress get for themselves. And while it will take a few years to fully implement these reforms, there are numerous protections and benefits that would start to take effect this year. This year, small business owners will receive tax credits to purchase health insurance. This year, thousands of uninsured Americans with pre-existing conditions will finally be able to purchase coverage. Insurance companies will no longer be allowed to deny coverage to children with pre-existing conditions, and they'll no longer be allowed to drop your coverage when you get sick.